COVID-19 information can be confusing. It's changing as the virus does and can be different depending on the doctor. Like just this week when looking at the Omicron wave, is it ending or isn't it? Canada's top doctor said, for now, any dip in the national epidemic curve is most likely an artifact of underreporting and underdetection of cases. But BC's top doctor then said this.
We're getting the sense that we have leveled off somewhat, and if we look at what we're seeing in other jurisdictions that have been ahead of us in terms of this wave around Canada and around the world, we may be entering soon into the place where we will see a decline.
How are you supposed to tell what's right or wrong? A local data expert, UBC's Sally Otto, who's also on the independent data modeling team, says it's not always simple.
I think both are right to different extents. I think the case numbers right now are plateauing in Canada and Ontario and in BC, but that is irrelevant because we know we're at testing capacity limits. So we can't just look at raw case numbers and really know anything.
And the data being assessed, she says, may be different. Like BC just received new wastewater data showing a decline in COVID from a month ago.
I suspect that that's what Dr. Henry had seen, saying, oh, well, we're not continuing to see the rapid rise in the wastewater data. And so maybe that's what she was seeing.
But then there's guidance around masking in general. N95 or an equivalent respirator specifically.
I'll just say in the majority of settings, the incremental benefit in a low-risk setting like a school or a retail store is minimal. What is most important is that you have a good-fitting mask that you wear, and you wear appropriately.
When you are putting on a mask, make sure it fits. Get the best quality mask you can get your hands on.
They agree on a good fit, but Tam has been touting N95s for more than a month.
Hearing from Dr. Henry that a cloth mask alone is fine, it sends mixed messages.
And for Vancouver family doctor Anna Woloch, a mask proponent from the very start of the pandemic, the science is clear.
The material of the N95s have an electrostatic charge in it, and that helps trap the aerosolized particles.
Medical masks don't do that, and she says N95s fit faces more snugly. Part of the reason behind the mixed mask messaging from BC's top doctor may be because not everyone can get the masks or afford them.
So it is an equity thing. On the other hand, not protecting our teachers and others that we're asking to go to work seems equitable too.
One issue where there is consensus across the board right now, Otto says, is that the end of the surge of Omicron cases is around the corner, hospitalizations a few weeks later.
In the next week or two, the models do predict that we should reach a peak in cases and it should plummet on the other side. So as fast as Omicron went up, it will come down.
In Victoria, Liza Yuzda, City News.